Botox and fillers, they can both be helpful, but in completely different ways. So joining us to share the difference and to talk more about the procedure is patient consultant Kelly Ivy-Subak from Dermique in Feeding Hills. Great to have you, Kelly. I went and saw you on Friday at Dermique, and we talked about the difference between Botox and fillers, and you're about to find out what those are. But I think a lot of people fear that they're going to look unnatural or like celebrities that look kind of distorted
Yes.
and not natural at all.
If they do anything, that they're going to end up with that, you know, big pout Meg Ryan mouth. And that's really a look that you have to go after to try to achieve. It's not something that happens accidentally. And in our office, Dr. Swarzeski is an extremely conservative injector. So he would rather put in a little bit, have you come back, let us recheck it, make sure it's appropriate for you, and then know exactly what your levels are. He also feels that it's important who's doing the injections and that a surgeon needs to do it so that he fully understands the functioning of the face, the anatomy and physiology, and not just a weekend course that he's taken to decide now he's going to start doing injections. I mean, this is something he's been doing for 25 years, so he's very comfortable in it and does an amazing job.
And he's the only one in the office that does that.
Only one in our office that does the injections, and he's very adamant about that, and I think that's a good thing. It makes our standards a little bit higher for the result of the product that comes out.
And for a limited time, you're actually offering a special for Botox and fillers.
We want to encourage people to try it, maybe people who've been a little bit hesitant, and I do find that they are surprised that it is quite affordable. It doesn't have to be thousands and thousands of dollars. Normally, Botox is about $14.40 per unit, $14.40 per unit. We're doing an $11 a unit now, so that really does bring the price down quite a bit. And a syringe of a filler is normally around $6.95, and for this month we're doing it at $500. So that is huge savings and kind of gives you a little bit of incentive to give it a whirl and try it and see if it's something you like. And you always, if you don't like it, you don't have to keep it. It's not a permanent solution.
Right.
I mean, Botox is 3 months and fillers are a year. So try it, give it a whirl, and if it's not for you, it's not for you. But most people do tend to love the look that comes out.
And that's for a limited time, so make sure that you give them a call if you are interested and find out more about it. And of course, consultations are always free of charge.
Please come in. Let us look at you.
Thanks, Kelly. Nice to
Thank
be
you.
with you. And now I'm sure people are wondering, what is the difference between Botox and fillers? Well, you're about to find out. Take a look.
Facial injections, I think there's a lot of confusion about what they are and what they do. So first, Botox. Botox is what's called a neurotoxin, and its point is to relax an overused muscle. Now, it's been used medicinally for 30 years. Obviously for headaches, we see all that, but also bladder incontinence and all kinds of different things. But we use it for cosmetic purposes. And what it does is it goes in and it stops the synapses of your brain saying, I want to move this muscle, and we don't want to move that muscle because it causes wrinkling. So if you come in and you're able to relax that muscle for 3 months, because that's how long it lasts, we're actually able to kind of erase the wrinkle in that area. So the areas that we usually use neurotoxins are in the forehead area for those vertical lines in through here, and the glabella to relax this muscle. Also around the eyes for the crow's feet area. We also use it on the corners of the mouth to relax the mouth. And it does not move from the area of placement, and I think that's a big fear that people have, is that they're going to find it in the bloodstream or it's going to go someplace else and they're going to look funny. It cannot metastasize past that area. Also, it only lasts 3 months, so if it's something that you try and you just don't love it, it's gone, it's done, it's never to be done again. But that's rare. Most people come back because they love how it looks. Lip injections are totally different than Botox in its uses. It's usually done with a hyaluronic acid-based gel, and it's a natural substance found in our body, so our body readily accepts it. And when it goes underneath the skin goes, oh yeah, I know you, I'm going to keep you around. Its job is like little tiny sponges, if you can picture that. It absorbs fluid from the surrounding tissue. So when we put it in the nasolabial fold, in the marionette lines, around the lips, the cheek area to bring the cheeks back up, chins, even to fix a bump in the nose, it kind of puffs up a little bit, and then we get that fullness, that natural fullness that we're looking for. So some of the common areas that we would inject on a patient, Nancy's one of our typical patients that would be treating every day, are around the eyes. So we'd want to smooth out the crow's feet area so that when she smiles, this no longer creases. The areas for filler that we would use on her would be in the cheek area to restore her apples in her cheeks. And that's what tends to happen, is we lose the fat in this area and it kind of comes down here. Absolutely not the look we're looking for. So by putting in a filler a soft gel in through here. It pulls everything up and it restores that cheek area. We can also put a filler in by the jawline so that we remove this little jowling area and kind of pull this back. And when you combine this filler and Botox with some of the other treatments, you get an all-over 3D rejuvenation look. Also, other areas that we would fill is what's called the marionette line, which is right through here, and then the nasal labial fold in through here, so that we would fill that up. And then doctor may also put a few units of Botox in through here, so we would turn her smile up. We can also put a little bit of filler right through here to smooth that out, and she would have an all-over rejuvenated look after this. One of very important things that you also want to pay attention to if you're coming in for injections to our office, any other office, you want to make sure that the product that you're using is a branded product, that it's not an off-label product. You don't know where those are coming from. There has been a lot of issues with product coming in from Canada that may be not so safe. So you always want to make sure that you see the box of the product that is being injected in you, and it's also great to look for a sign that has the surgeon or the doctor's name on it that says they have qualified to do the injections. That's a huge thing because it does take training. It is not something that happens overnight or in a weekend course. It takes experience, and you want to look for that in any office that you go to. We want you to look natural and youthful and really feel good about yourself when you look in the mirror.